Okay. Hi, everyone. Can you hear me? Okay. I would make it short. Just like Amy said, I was the next candidate after Amy. So we sort of have similar path when it comes to our academic achievements. She was on the college one, so she used to go to college once a week. I was on the apprenticeship, so basically it's only my lectures that I have to do virtually. Everything was practical. So I will go for lectures and take the theoretical aspect or clinical, learn the book, and then come to the dispensary and then put it in practice and then collect evidence. So I won't go too much into college stuff, but I can tell you the things that I was able to transfer and the skills that I was able to integrate when I came into hospital. I had worked in community pharmacy for a few years. So I said, okay, let me go to the hospital pharmacy and see how the hospital pharmacy also works. So I came in as band two, but before that, I had medicines, counter medicine certificate from Buttercup, and then dispensing certificate. So I know how pharmacy was working in community. And I came in as band two inpatient dispenser. And I started from there. So when I came in 2018, I think November-ish, I started working in the dispensary and going to outpatients and inpatient and working everywhere. So when the opportunity came to apply for the apprenticeship, I did. And I was successful out of about 8 or so candidates. So you have different people from different, because we've got two sites, different sites applying for it. And then I was successful. So I came after Amy. And then when I started, not too long, we had the first lockdown. So it was a bit of a challenge, not working closer to people that I was working together with anymore. And we had to learn a new way of working together, talking to people from afar and going on to the wards was a bit of a challenge, but it was an experience. And I think that in that time, it built resilience. It sort of strengthens you. You build your confidence, and it challenges you that anything that you face during your working environment or when you change your work experience or when you want to start something new, you need to have the resilient attitude. You need to be resilient because certain things change. If you want to come into hospital, you want to work in pharmacy, remember that you are starting something new. You are not, it's not something that you're familiar with, but you have to be determined. And like Amy said, there is no 2 days the same in the hospital environment. There's no 2 days the same in the pharmacy environment. Things change, and COVID changed our whole working attitude. And that transition was a bit of a challenge, but we managed it. We became a team that worked together, and we were in our own little bubbles. When you come to work, if you are in inpatient, you are with the inpatient bubble. If you are in outpatient, you are in outpatient bubble. When you go to the ward, you are in the ward bubble. So you go in and then you have to come in and change, just scrap down and desensitize yourself. So it was quite an experience. And one of the things that during that time I was my department was able, one of the experience was going to Headley Court. It was one of the centers that we were using for rehab. So I was exposed to the COVID and how patients were rehabilitated before they went back home. So during my time as a student tech, one of the experience I had was that because we had other clinics that are associated with the hospital, and sometimes the opportunity will come if you're a student or as an employee. Do you want to go and experience how things are done in certain departments or clinics? And I had the opportunity to go to Headley Court for a few months, and it was quite an experience, and it was eye-opening, working with some of the doctors, with physiotherapists and discharge coordinators, and all the other professionals that you see on the ward every day, or sometimes in the dispensary you may not see them, or you might see them along the line, but sometimes for a period of time you would have to work with them as a professional and acting as a professional and then impacting within that team as well. So that was one of the experiences, that the exposures I had when I started, when during my student journey. Currently, I am about to start another development, which is senior technician. But currently, I am a tech for community. We have 3 hospitals that I am sort of in charge from here. We dispense their prescriptions, we screen their prescriptions and orders and dispatch them every morning. So when I come, my mornings are quite packed and full. Every day is a different thing. Every day you are not chasing the same thing. You are chasing different medication for different patients. As of today, we are urgently trying to order something for a patient that we hope we might get it for them tomorrow before the weekend. So every single morning, there is something new, exciting, and challenging for you to look up to. So you have something that is going to occupy your time, your mind, and is going to open your understanding of how pharmacy is. So you have to be open-minded. It's one of the things, and you have to be flexible, because if your patient needs something, you have to go out of your way, go into all the other departments. I source from everywhere. I'll go to procurement, asking everyone in procurement, can you do this? Can you find this? How do we do this? So you need to have the attitude of also questioning and asking questions. It's also something that you have to develop, and then you will also be supported when you come here. Every single one, like Amy said, every single person in the trust, in the department is very, very helpful. If you ask them the question, it doesn't matter whether you've asked it 10 times in a day, they will have an answer for you. They will direct you, go and see this person, go and ask this person. I think I have seen this. I think I have heard it. And these are the things that helps and support us. If you come into this department, if you come to work with Epson and St. Helier, we have wonderful people here, and we will support you in any journey or development that you want. The opportunity is here. The opportunities is available, and we have people that will support you. If it's educational side, we have our educational pharmacists, we have our educational tech, we have students that are learning. We have 2 students at the moment, and we have some that are graduating. I think we've got some that is recently graduating. So we have people at every stage and at every level that will help you to understand any work that you're struggling to do, any evidence that you need to collect for your portfolio, anything at any stage. Everyone is there to support you. We have people that have worked in community before. We have people that have never worked in community before, but they've been in hospital and they locum. So they go in and bring some sort of integration into pharmacy outside the hospital. And in the hospital, we have people that have worked in different trusts, and we share ideas. So we learn off each other. We have regular presentations, we have regular huddles, we talk about things that are happening, and we inform ourselves of what is going on. So you always not short if you need someone to help you. And when the opportunity comes, we are told if there's something going on, if there's new opportunity, there's new job role coming, we are told about it. So you would go and ask questions. This is what my strengths are. This is what my weaknesses are. What can I do to develop myself if I want to go into procurement, if I want to go into medicines information, if I want to learn something about non-formulary or clinicals, MMT, medicines management technician. If I want to do it, how do I do it? We have assistants that take time and go onto the ward with MMA, medicines management assistants, or the management technicians, and know how the ward works, so that they will know. If you have a member of staff on the phone, if you have a nurse on the phone, you have a clerk on the phone, or you have a doctor on the phone talking about something, you can understand them and then direct them to the right person. So we have all of these opportunities that we do. So all I would say is that it's quite a very fantastic environment and family network that we have here. So if anyone out there is interested, anyone on this platform is interested, don't waste time. Go on there and apply. And we will see you soon. If anyone got any questions, you can ask us. We are still here, and then we will answer your questions. Thank you very much.